As a baby boomer growing up in the rock and roll era, one of the most famous expressions were, if the music's too loud, you're too old. Well, the baby boomers, trust me, they are older, a lot older than they were when they used to say that phrase. And hearing loss is not a funny topic. It's a serious topic. It affects a lot of people who really don't know what to do about it and really are not doing anything about it. That's kind of a surprise itself. But what is also happening is we've got a lot of younger people who are losing hearing as well, and a lot of it because of earbuds and devices that they simply have up way too loud, and it does take a toll. We are joined today by audiologist Diane Nance. She's serving the Detroit area as well as many other places. She's been practicing for over 25 years in a wide range of settings, including ENT, physicians' offices, the Veterans Administration Outpatient Clinic in Martinez, California, and the Eye and Ear Institute of Pittsburgh. She's joining me today from HealthInnovations to talk a little bit about hearing loss and what you can do about it, but also what you can do to help prevent hearing loss. To Diane Nance. Diane, good morning. How are you today?
Good morning. It's good to be here.
I'm sure, maybe heard that topic or heard the subject or what I've said before. If the music's too loud, you're too old. A lot of music's simply too loud, but it's really too loud. Really, personal music devices are up way too loud for a lot of people, and I guess that's something. How big of a problem is that?
Well, we are seeing that problem on the rise, I will tell you. Hearing loss in general affects 48 million Americans. We are seeing, as you mentioned earlier, the younger population joining in on those numbers. And we're seeing that the number one reason is noise exposure, and that means turning their personal listening devices louder and louder to really enjoy their music. So that is a big factor. It's considered noise-induced hearing loss, and that is something that is cumulative, meaning that when you turn the music up the first time or the second or third time, you may not notice any change in your hearing. But over a period of time, when we put ourselves at risk by turning that music louder, that can have an impact on our hearing. And that's what we're seeing with the younger folks.
Is hearing loss a cumulative type of significance in terms of the way, in terms of over a course of time, and being the greater number of exposures over a period of time, does that have a cumulative effect?
It sure does. Yeah, let me explain that here. So the noise-induced hearing loss is cumulative because the damage can start when we're young and get worse over time. So the more often we expose ourselves, we are putting ourselves at risk. Just a little more information on that. It's also invisible because it happens without our even noticing it or until it's too late. And once that has set in, it is permanent. Because unlike a broken arm that gets better over time, unfortunately, we can't heal our hearing. So once it's damaged for good. And another fact for the listeners to take note of is that noise-induced hearing loss is preventable. So we can talk about ways to prevent that from happening.
Okay, well, we talked about personal music devices. What other things are I guess, causing hearing loss? What are the other greatest causes of hearing loss that's out there right now?
Sure. Well, we all live in a very noisy world these days. So there are people that work in noise, so occupational hazards, factories, all kinds of occupations. We also have recreational influences, so motorcycles and snowmobiles, even power tools. In addition, even people may not think about going to a sporting event or a concert. Those can be very noisy environments, and when we're in those environments, we should be using some ear protection.
Ear protection. What is the best ear protection to be using? If simple earplugs, or I guess I know occasionally I do a bike ride that I go across the country on, or I go across the state on each year, and some of the places I stay are pretty noisy, and I have some cushions that I put in my ears, basically ear pads that help reduce, at least let me get a night's sleep. But what are some of the things people can do? I guess earplugs, so to speak. But what can you do to really kind of, be prepared?
Sure. You want to be prepared, like you said. And so if you know that you're going to be around noise, you definitely want to have ear protection. And as you mentioned earlier, there's all kinds, from the very simple plugs that are foam type, and you can put them in your ears. There's ear muffs, those larger headphone type muffs that fit outside of the ear. And then there's also custom ear molds that are custom ear protection. And that would be something where a person would go to an audiologist and discuss the ear protection choices that they have, and they would make them so that they fit their ear. And so it's a custom-made product.
You know, it occurred to me that a lot of people will go to the eye doctor if they're not seeing well and have their eyes checked, and they'll go, if they're not feeling well, they'll go to their regular doctor and to other. But, going to hearing is sort of the kind of thing that a lot of people think, maybe I'm just a little bit older, or maybe I'm how do you know, and how often or when should you see a hearing professional?
Sure. Well, number one, let me give you the signs of hearing loss. This is important. So some signs are when a person turns the volume up on the TV or the radio, speech can become unclear. They may say, I think people are mumbling, asking people to repeat more often, and having difficulty following conversations in groups and background noise. And I will tell the listeners that many times friends and family members may notice one is having difficulty hearing way before the actual individual does. And it's because the brain adapts to the hearing loss. Typically, the hearing decreases very gradual over time, so it may not be noticeable to the person with the loss. So we see that a lot of times the friends and family members will notice first. But I will tell you, untreated hearing loss truly does affect people's life. It affects in the way that they connect to friends and family. When a person does not have a hearing test and pursue recommendations, if they do have a loss, we do see sometimes they withdraw socially. We can see depression set in. It's even been linked to dementia. There's a correlation. But by contrast, when people do treat hearing loss, it's been reported significant improvements in relationships, self-esteem, and just overall quality of life. So it's really important, if any of the listeners have noticed any signs of the hearing loss, they want to talk with their doctor to get a hearing test or an audiologist, and that way they at least have a good understanding of their hearing, and they can consider that a baseline hearing test.
I was reading some of the statistics that were sent to me, but more than 85% of people who could use a hearing aid, could benefit significantly, simply don't use them. Why is that? Is it because of the concept, or because of the past impressions or imagery of a hearing aid? Is that it?
Well, there's a few factors involved with that. Well, first and foremost, at HealthInnovations, we're very passionate about education and getting the word out there about hearing loss, the impact of untreated hearing loss. So there's barriers, and one is that lack of awareness. People just really don't have a lot of information. As I mentioned earlier, it is invisible. So it's easy to kind of prioritize other medical conditions. We also have the negative word of mouth. People have experienced hearing aids and, maybe put them in the drawers. But there's a lot of reasons for that too. So that shouldn't stop someone from pursuing a hearing test and if hearing aids are recommended. And finally, we have cosmetic concerns. The hearing aid industry is listening, and many times how the hearing aid looks really does matter. And they're making them more sleek and cosmetically appealing. And finally, cost. Cost has been the number one reason people are not purchasing hearing aids. And another mission that HealthInnovations has is to provide more access and affordability for hearing aids. So one can get a free hearing test. We are a nationwide company. Have that free hearing test done, and then if hearing aids are recommended, we do provide those at a fraction of the cost. So it's really something where we're trying to make sure everybody has access to hearing aids.
And I think I said the name incorrectly at the beginning. It is Health Innovations. Is that right? The HI ahead of Health Innovations, correct?
That is correct.
And if someone is interested in getting more information about what services are available, what the company is all about, a little bit more about you, I'm guessing the website that I've got in front of me is probably the best place to start. Is that right?
Yes, they can visit our website at www.HealthInnovations. And as you mentioned, that's HealthInnovations. Or if one is not on the Internet, they can call our toll-free number, and that's 855-523-9355.
Again, HealthInnovations.com. Diane Nens is a guest, and the number again is 1-855-523-9355. Diane, thank you so much for joining me today, and thanks for clearing up, and I guess letting us know just a little bit more about what this problem is all about. Thanks again.
Thank you.